Welcome to the Mountain West AETC Project Echo. I'm Kent Unruh, and I'd like to turn it over to Dr. Brian Wood, our medical director, to introduce our guest.
And with that, I'll turn it to Dr. Steckler, who's going to share some data looking at PrEP knowledge and prescribing habits, focusing on Washington State providers as a sort of jumping off point for discussion about where things stand in PrEP in the Northwest. Joanne, thanks.
We did this survey earlier this year of Washington State, and we're bringing this to you because I think some of the findings are really interesting in thinking about how we do PrEP expansion, but also we'd like to hear some of your thoughts and experiences and how we move forward in providing additional support to you all, as well as additional support to maybe the primary care providers that you're assisting with for PrEP. So as just very quick background, as you all know, PrEP was approved by the Food and Drug Administration in 2012, and then Washington State, the Department of Health, implemented the PrEP Drug Assistance Program, or PrEP-DAP, in 2014, in early 2014, to assist with medication costs. We know that PrEP uptake and knowledge are increasing nationally as well as locally in Washington and the Northwest, but we're still not quite reaching everyone who would benefit from PrEP. And so our goal in the next year and change is to really assist in providers to learn about PrEP and to make prescribing easy. So we did a needs assessment in May and June of this year. It was supported by the AIDS Education and Training Center, by the Department of Health, and by the University of Washington. And we surveyed all licensed medical providers in the state of Washington to understand knowledge practices and current barriers to scale up and we were really interested in primary care and non-specialty care providers. For those of you in Washington, thank you if you completed this survey for us. Interestingly, I was not on this email list. I don't know how many of you were and completed this for me, but I was not. So we obtained emails from the Washington State Department of Healthcare credentialing for any licensed DO, MD, NP, and PA, as long as emails were associated with the licensing. So clearly mine was not. And then I sent emails out individually with a link to this online anonymous survey that we conducted in REDCap. We were interested in providers who regularly saw HIV negative patients who were over 14 for primary or longitudinal care, for walk-in emergency care, for any STD or family planning, or for any OB-GYNs. And our goal was to be broad with this and not focus only on any subset of providers. We didn't, unfortunately, provide any reimbursement, so again, thank you if you completed this. So of the 27,000 licensed providers there are in the state of Washington, about half of them had email addresses associated with their license. So I sent out over 13,000 emails. 2,000 folks initiated the survey to see if they were eligible. 812 were eligible, and then of those 812, 735 said they had a practice that was primarily in Washington State. So there may be folks who are licensed in multiple states. Probably on the Portland border, there may be Oregon providers who are also licensed in Washington. If they did not say that their primary practice was in Washington, they are not going to be described further here. So that's the difference between the 812 and 735. I'm going to mostly talk about the 735 providers here. Of those 735 providers, actually about 2/3 had heard of PrEP before, which is great. And this chart shows you some of the demographics of respondents broken down by whether or not they had heard of PrEP versus not heard of PrEP. There was no difference between gender and whether people had heard of PrEP or not heard of PrEP. Age, interestingly and not surprisingly, if you were younger, you were more likely to have heard about PrEP. If you were an older provider, again, these are MDs, NPs, PAs, and DOs, there was an association between age. And then interestingly, MDs were also more likely to have heard of PrEP compared to other providers. And there was no association between race and ethnicity in terms of whether or not providers had heard of PrEP versus not heard of PrEP. I'm going to show you a few maps that were put together by the Department of Health for us. And just for those of you who aren't totally oriented to Washington State, so just sort of our major cities follow along the I-5 corridor, starting up in Bellingham and Whatcom County, Everett down in Snohomish County, Seattle sits down here in King County, Tacoma and Pierce, Olympia in Thurston County. And then Clark County is Vancouver, Washington, which of course borders on Portland, Oregon. The major other cities in Seattle that in Washington State that we're going to be looking at are Spokane out here in the east, and then probably the Yakima area. This map shows you the number of providers who responded to our survey, with the lower numbers in blue and the sort of higher numbers of providers in red. So we got a really nice representative sample from across the state, with of course more providers responding from the major cities, as you would expect where there would be more providers. This breaks down the map in proportion of the respondents who have heard of PrEP. So the lighter numbers are a lower proportion have heard about PrEP. The dark blue is the higher number who have heard about PrEP. And it can be a little bit confusing why there may be, if you get out here in some of these smaller counties, why these look blue, surprisingly. And it's probably because only 1 or 2 providers responded to the survey from that county or from that zip code, and so they may be more likely to have heard about it. But we're still going to be mostly focusing on our major cities where we have the greatest number of new cases. Again, high numbers in the Bellingham region who have heard about PrEP, down here in Everett, also fairly dark, and moving along similarly, that the places where we have more cases, where we have more providers, many of them have heard about PrEP. Next, we asked providers if they had ever discussed PrEP with any of their patients. And this again is the proportion based on the number of respondents. We're looking here at dark blue are the higher proportion who have ever discussed, and yellow is the fewest. And again, the darkest, the blues and the greens, follow along this corridor with our number of providers down here in Clark, as well as out in Spokane. I should also note that this is an inset. This insert is of the Puget Sound area, with this being King County here. And then you can see a little bit looking at Pierce County, which includes Tacoma. This looks at the number of providers who had actually discussed. So of the 400 and change providers who had heard about PrEP, about half had at least discussed it with at least 1 patient. The median number was 3 patients. So on average, these providers aren't having a lot of discussions about PrEP. So the interquartile range is 2 to 6, so 75% of our providers who said they had had a discussion were reporting fewer than 6, although the range goes up well into the hundreds. And I think this is really interesting and something that we're probably seeing a change in over time as more of our patients are being aware of PrEP, that the number of, we asked providers what proportion of their conversations were initiated by the provider. And I think this distribution, it used to be that for most of the providers reporting that all of the conversations were initiated by patients. And I'm going to ask all of you at the end of this what your experience has been. But what you can see on this distribution, this is 0% of conversations initiated by provider. This is 100% of conversations initiated by provider. That although many of them sort of go one way or the other, there is a mix in here of the number of conversations that are initiated by providers, so identifying someone who is at risk and might benefit, versus the patient sort of asking the provider whether or not it's right for them. We asked providers what their top concerns were about PrEP prescribing. And as you look at this, I'm going to ask whether or not this resonates with you as well. They're ordered based on the total number of providers who have heard about PrEP and what the top concerns were by those providers who had heard about PrEP. So the top concern was adherence to medication, cost to patients. And then the next one here is that overall, 33% of providers who had heard about PrEP weren't certain who PrEP was correct for. But what I show here in these 3 right columns are divided into providers who had heard about PrEP but never discussed it, of which there are a fair number, 250 or so. And then the providers who had had a few discussions with patients, 163, versus the 57 providers who are over the median number of conversations that they've had. And I'm not showing you the numbers where there's no difference among the groups, but I thought it was interesting that, and perhaps not surprising, that providers who had never discussed PrEP with a patient were much more concerned about that they didn't know who PrEP was right for, compared to the providers who had discussed PrEP with a fair number of their patients. That the people who've had those discussions before felt more comfortable about who to identify as a person who is a PrEP candidate. Risk compensation, drug resistance, drug toxicity, interestingly, was reported as a concern by fewer providers who had never had conversations, compared to providers who had had more conversations. And then finally, effectiveness, less of a concern among providers who are having more of these conversations. Down here, I just want to remark that about 15%, or that's about 1 in 6 providers who had heard about PrEP reported they had no concerns about PrEP at all. And then finally, I think this is one of our more interesting maps. This shows you the total number of prescriptions reported by providers by zip codes. And I apologize that the maps change colors, but what you're looking for here is the blues and the greens. So red is never prescribed any, but the blue is sort of the density of where these prescriptions are being written. And the inserts are probably going to be the most interesting to you. This is Spokane, out here in eastern Washington, with about 100 prescriptions reported by the providers who completed the survey. Several hundred being written, not surprisingly, in King County. And then Clark County also has quite a number of prescriptions. Again, this may not even account for the providers who reported that their primary practices were in Portland, but who may also see folks in Vancouver, Washington. This comes out to, of 124 folks who had reported that they had prescribed PrEP before, with a median of 2, again, small numbers on average, it totals up to 1,000 or so reported prescriptions of PrEP across the state. So this map has also helped us to identify where there may be fewer prescriptions being reported, and we can talk a little bit about places around the state and around your regions where you may think we need to do some more work in helping providers to prescribe PrEP. I think I'm working on my last couple slides. Thinking about this, we asked providers how comfortable they were in discussing topics related to PrEP, and I just want to point out that overall people were pretty comfortable, but the one place where people were least comfortable, and this is all providers who had heard about PrEP, that talking about costs of PrEP and insurance coverage for PrEP was one of the topics that people felt least comfortable. I'm not showing this here, but the providers who reported prescribing were more comfortable, but still they reported less comfort in this topic than in other areas. Finally, as barriers, cost, and insurance come out, of the 124 prescribers, many report having to deal with prior authorizations and insurance denials, and 134 providers who had discussions about PrEP reported that they had not prescribed for at least one patient due to patients being low risk or to insurance or cost issues coming out again. And then finally, we were interested, as this is a needs assessment, of what providers would access as print materials, but I also ask you to all think about this as online materials of what they would find helpful in supporting them in prescribing. And the top one that came out was a review of the guidelines. Again, this is all 735 respondents. The one that came out much more for folks who had prescribed frequently included the protocols and visit checklists, was much more common among people who had done prescribing. So I just, in conclusion, that we've done a great job. 2/3 of our providers know about PrEP, but education is still needed to inform Washington medical providers, with particular attention being paid to cost and insurance issues, that many PrEP providers have few PrEP patients, and we should probably be thinking about these groups of providers differently than the PrEP experts. And then we, of course, need to continue doing work, and DOH has been doing this, to ensure that insurance and cost do not present barriers to effective HIV prevention. The shout out to Kelly at DOH for doing the maps, and those of you who completed the survey, again, thank you very much.